Hello, good afternoon. My name is Dr. Mugisha Kyaruzi. I'm a cardiovascular surgeon specialist working at a university hospital and private institution. Today, I want to talk about the techniques that we perform in our department of cardiac surgery. First of all, before I continue, I want to explain about the what's the meaning of the open heart surgery. Open heart surgery is the surgery which is performed whenever a patient has a structural disease on a heart or any thing concerning the heart with the defects, either congenital or acquired defects, is when we do require to perform these surgeries of open heart surgery. Most of the patients who receive the heart surgeries are patients with structure problem, which includes the occlusion of coronary vessels which are feeding the heart, or the valves within the heart. And we have four valves in the heart, which includes the aortic valve, the mitral valve, tricuspid valve, and pulmonary valve. And also, we treat the diseases like the great vessels originating from the heart, which includes the ascending aorta or the pulmonary artery. And sometimes we do have diseases like the tumors within the heart, and these tumors are also treated by open heart surgery. Instead of that, apart from that, we have diseases like the defects, which are most of the time are congenital, and this includes the arterial septal defect, which means the ASD, or the ventricular septal defect, and other congenital defects which are underdiagnosed during uh, the birth period, and when they become in adult stage, for the reason that they don't give symptoms, that's when they are accidentally diagnosed, and the patient are required to undergo surgery. But as a part of my department, we do also different other, we do also other type of surgeries like ventricular assist devices, which helps to assist the heart for the case when the patients do have the decreased contraction of the heart and they require surgery. Sometimes we do perform this type of surgeries. But recently, to minimize the burden of open heart surgery, because the open heart surgery is a surgery which is performed by opening the chest. We break down the breastbone, the sternum, and reach the heart. And after reaching the heart, we perform this type of surgeries. And this is known as the uh, uh, heart surgery. But to minimize this burden of opening the chest, we do have the surgeries whereby we don't intervene the sternum bone or the breastbone. We do not open the chest bone. Instead, we do very, very small incision through the thorax. And this is known as the minimally invasive approach. But the history of minimally invasive approach comes into different stages, which includes the opening a part of the sternum, one third the upper part of the sternum sometimes can be open, and this is less invasive and not truly minimal invasive. But when we do the surgeries whereby we don't completely open the chest bone, we pass through the thorax by the aid of cameras or with our own naked eyes, which we call the direct vision, and this is known as minimally invasive cardiac surgery. Um, all patients who are diagnosed for heart surgery um, with either coronary diseases or with valve diseases or with great vessel diseases or tumors or defects within the heart, they can be treated through open heart surgery. But when we want to perform minimal invasive surgery, there are specific criteria to do this kind of surgeries. We evaluate the patient in many ways, which includes uh, which includes watching or diagnosing the patient with other type of diseases like the pulmonary disease or the kidney diseases or other organ diseases. These patients, they sometimes cannot be suitable for minimally invasive cardiac surgery. And sometimes when patients do have a high morbid obesity and at the early stages of performing this minimal invasive cardiac surgery, it might be very, very difficult. And that's why we we say that some of morbid obese patients cannot be the candidates for minimal invasive cardiac surgery. But when a surgeon gains much more experience, he's able to perform a wide spectrum of patients, which include the obese patient, and these are the patients who truly benefit from minimal invasive cardiac surgery, because they are the patient whom we don't want to open their sternum, but because it can affect these patients in many ways. Uh, Minimal invasive cardiac surgery is mostly suitable in patients with good versus peripheral vessels, because these peripheral vessels are the vessels whereby we connect the patient to heart-lung machine. In order to perform this minimal invasive cardiac surgery, we have to have very good vessels, which will enable us to connect this patient to heart-lung machine and be able to perform these type of surgeries. The risk of minimal invasive cardiac surgery does not differ from those of open heart surgery. The risks are almost the same, but the benefits of minimal invasive cardiac surgery is much more great. The benefits of minimal invasive cardiac surgery includes the less stay in ICU, less stay in hospital, fewer blood transfusion, and less risk of wound infection, because the incision is very small, and less blood loss after the operation, and more importantly, these patients they quickly return to their normal social life activities much more quicker compared to the patients who undergo the open heart surgery. And on top of that, these patients, in terms of cosmetics, they are very satisfied, and their state of well-being after the operation is much more great compared to the patients who undergo open heart surgery.